Thank you very much, Chairperson, for your kind introduction. Thank you. I begin with the name of Almighty God, who is the most gracious and merciful. Greetings and salams to all. Good morning, afternoon, or evening, wherever you are in the globe. Welcome to our Awareness Day program 2024. I have recorded my talk as I'll be traveling at that time. I'll try my level best to connect from the airport in the beginning of the program, but this event or program will be almost at my boarding time. So sorry about that. We started our Awareness Day program with Africa region on 7th November 2024, and then we went to South and Central America, North America. We had a global meet at all the regions came under one roof on Sunday, followed by MENA on Monday, and today is European region. This is our sixth program from Europe, and today's talk is New Perspective for Diabetes-Related Food Complications in the World. On 13th November, we have Southeast Asia, and lastly on 14th November, Western Pacific region, which will be our last program. Before I start my talk on New Perspective for Diabetes-Related Food Complications in the World, I would like to thank you very much to the organizers, Beata, Roberto, and Wilma, very good friends of ours, and their board members. Thank you very much. Special thanks to Dr. Adam Chirubas for accepting our invitation and be part of this program as representative of EC. You are most welcome, and it is privilege and honor for us that you are a part of our European Awareness Program. Once again, thank you very much from all of us, and you are welcome. I once again thank you on behalf of our board members 2023-2025. I come from Dar es Salaam, Tanzania, which is at the east coast of Africa. It is the land of Mount Kilimanjaro, Ngorongoro crater, Serengeti, the largest wildlife park, and Zanzibar Stone Town. You are all most welcome. Africa and Asia are two largest continents in the world, which caters the population of 76% of population comes from that region, and 80% of diabetes come from that region. The rest of the world is 24% of the population, and 20% of the world for diabetes come from that. So we have a huge burden in low and middle income countries. If you look at the prevalence of diabetes in this region, and you can see there is a high increase in all low and middle income countries, but Africa is going to lead the world in next 20 years, which is an increase of 134%. The prevalence of diabetes, as I mentioned, is increasing globally. The greatest increase will occur in Africa, and this is because of rapid demographic, social culture, and economic transactions. That means we are developing at the cost of health. Look at 20 years ago, we were only 7.1 million in 2000. Next 20 years, we became 19 million. And in next another 20 years, it is predicted that we are going to lead the world, which is not a nice thing to lead, 55 millions, which is 134% increase of diabetes. We haven't finished with communicable disease, and we are adopting non-communicable disease. So we have a huge problem, double burden. As diabetes is going to increase, diabetes complications are also going to increase: diabetic retinopathy, diabetic nephropathy, cardiovascular, and stroke. And what we are going to talk today is diabetic foot, which is 60% of non-traumatic lower limb amputations occur in diabetes patients. Let's talk about diabetes-related foot complications. Worldwide, as I mentioned, there is increase in prevalence of diabetes, and parallelly the complications are also increased. And out of all these things, food complications is going to be the dreadful complications, which is already a major public health problem, main cause of hospital admissions and cost. I'm going to talk on the burden of economic burden due to diabetic food. Cost is not going to be sustainable even by family, relatives, or nation at large. Commonly, in low and middle income countries, we have an infectious etiology which is associated with peripheral neuropathy or arterial disease. Amputation in diabetes. Gangrene and infections are the most common cause of amputations. True prevalence in low and middle income countries is never known. It will remain underestimated in the literature because our population, 80% of population lives in rural area, which is never reported. Published reports implicates the delay presentation is the main cause of amputations. Most of the patients needs amputations who die before even reaching the surgeons. So in 2005, it was a diabetic foot year where we calculated that every 30 seconds an amputation occurs due to diabetes. And when we recalculated in 2017, it went to 20 seconds. That means instead of 2, now we are doing 3. We are getting 3 amputations somewhere in the world to diabetes. That means we have gone from bad to worse. 1 minute, 3 amputations somewhere in the world is happening. So it's a huge problem. Global economic burden of diabetes related to food complications in 7 regions. Look at the background. USA expenditure on diabetes was estimated about 237 billion in 2017, with 30% of being attributed to diabetes related food complications. In the UK has been calculated that 1% of the entire UK budget, NHS budget, has attributed to diabetes related food complications. It is also reported that 6% of national health budget for Barbados was allocated to diabetes related food health complications. Brazil study showed that millions are spent on outpatients and similar to inpatients which are related to diabetes related food complications. So in low and middle income countries, data on the financial burdens are very less despite the report says it's high prevalence. In 2012, costs of studying diabetic foot ulcers in 5 countries, Chile, India, Tanzania, China and USA, 3 continents were done. In 2023, we expanded this study to 7 regions, namely all Africa, Sub-Saharan Africa, Europe, Middle East and North Africa, North America and Caribbean, South and Central America, Southeast Asia and Western Pacific. The aim of this study was to evaluate the cost across the world in 7 regions of treating 2 hypothetical wounds at a different severity. So we gave them a tool to evaluate the cost across the world of these 2 hypothetical wounds of different severity. The first one which you see here is a neuropathic ulcer and this is an arterial ulcer. So we got a total of 36 countries, 51 centers globally from all the 7 regions. And these were the mean cost of treating the wound. And you can see that in Africa, the mean cost of treating wound, approximate 2,400 US dollar, and cost related to NACA, that means North America, which approximate was 0.06 compared to what you have in North America, which was about 41,000 US dollar. And average annual salary in Sub-Saharan Africa is about 1,113, and it comes to about 30 average time to cover the cost salary. 30 months salary is the cost. Let's look at the Europe, which is your region, where we saw the mean cost of treating the wound was 17,600 US dollar approximate, which was approximate about 7.5 months salary of that individual. And this is still was about 0.3 cost relative compared to America. So global epidemiology of diabetes related food complications in 7 regions are as follows. It's a huge burden, as I already mentioned. The prevalence rate all over the world is about 6.3% of diabetic foot ulcers. 19 to 34% of people with diabetes will develop an ulcer in their lifetime. 70% have got a recurrence in 5 years. 40 to 6% across the globe end up with non-traumatic amputations. 85% of them can be prevented if proper implementation is taken. If you look at it, the North America and Caribbean region, North America had the highest prevalence of 13%, USA was 13%, Canada followed approximate 15%, and a major cause of hospital admissions. That's the most highly facilitated centers. Caribbean was found to be the highest rate of amputations due to diabetes. Europe, 5.1% average, and the Belgium was the highest prevalence, which came to about 16.6%. Western Pacific, 3%, and Australia has the lowest rate of ulcers, diabetic foot ulcers, about 1.5%. Asia had a prevalence of 5.5%, and the highest still it was in Africa. We all know that are still underreported, which is 7.2%. Let's talk a little bit about global view of diabetes-related food complication in African sub-Saharan continent. That this was a paper which was published just 2 years ago, which we looked into diabetic foot in last 60 years, 1960 to 2020. I'm going to show you few statistics from Africa. Let's start with peripheral neuropathy. And you can see peripheral neuropathy, wherever you are in Africa, is almost similar what you see in Western world, between 5 to 80% in Western world, and is a similar what you see in, and it's a major underlying risk factor for ulcers and infection in our part of the world. And if you do the literature review, we are almost similar what you see in the Western world. So whether you go 20 years or 30 years back till 2002, we were similar in with peripheral neuropathy. And when we did a comparison between Asian and African population, because we have the mixed population, the prevalence rate of peripheral neuropathy was similar whether you are Asian or an African. Look at arterial disease in Africa region. Peripheral arterial rates are increasing in Africa, and as I already said, it is increased because of urbanization. Rate across Africa are going upwards, and it's almost similar what we see in the Western world. Double digit. But if you see before 1991, we were almost single digit, almost unknown of arterial disease. So we have developed at the cost of health. So more peripheral arterial disease are becoming double digit, similar to what we see in the Western world. Even if you do comparison between African and Asia, before it was not similar, but now if you look at it, they are almost similar and not significant. Even we did a comparison with Caucasian population from Germany, African from Tanzania and India. This was a study done in 2003, which was published there. But at that time, neuropathy was similar. But if you look at the arterial disease, it was more in Caucasian population compared to African and Asian. So, Charcot neuropathy was almost heard in Africa, but as our populations are now getting more awareness and the life is prolonged, our people used to die of septicemia, but now we can see Charcot neuropathy, and you can see from Tanzania, one of the paper, 18% of Charcot neuropathy, and similar studies have done in Uganda and Egypt, about 12%. Time is tissue in diabetic foot. These are the diabetic foot which I see, and this is a diabetic foot attack is an emergency, has to be taken. Because this patient initially started treatment at home using herbal bath, razor bread, then they go to the traditional healers, then they visit to the primary health center, then they go to the district or regional health center, and by the time they reach to the specialized center, it's almost difficult even to save the life. Forget about the food. So look at the outcome admissions in African populations, and we can see that 54% of the populations come are almost late, Wagner more than 4, and die because of diabetic foot. And overall population in this cohort study, we found 27% of mortality. So high rates of amputation across Africa, if you look at it in last 10 or 20 years. Socio-economic factors. We still haven't finished in Africa with all these socio-economic factors: barefoot walking, inappropriate footwear, home treatment, tendency of seeing herbal doctors, and then overcrowding leading to a red bites. This is one of the patients who had come to us. We had gone to the herbal fat healer, and he told them that this infection, we should use your wife's scalp hair to reduce this infection. In the end, what happened? The wife lost all her scalp hair, and poor person lost his limb. This is a patient who was mixed with aspirin and dung. So these are still huge problem in our part of the world. D-Foot International, a mission with vision, and with urgency. Let me tell you about D-Foot International, our mission, goals, and focus of action, which are tailored to combat this war, which is globally we are facing. D-Foot International is a registered international non-profit association registered under Belgian law. D-Foot is an organization where all are dedicated to providing preventive food care, and these people come across 7 regions, as I already mentioned: Sub-Saharan, South Central America, MENA region, North American, Caribbean, Europe, and Southeast Asia, and Western Pacific. Our mission to promote the global profile of diabetes-related food complication, prevention, care through awareness, guidance, education, research, and professional development, ending avoidable lower limb amputations due to diabetes worldwide. It is a mission that knows no boundary and has impact on millions of people's life. The mission is not just a distant vision for us. It is a mandate, a call to action that demands the utmost emergency and urgency. Our goals is to prevent and reduce the number of unnecessary amputations from diabetes worldwide and improve the quality of their life. Our focus of action is training the healthcare professionals at the primary levels to manage diabetes-related food programs, giving healthcare professionals strategies, implementation, and how to sustain in the countries, promoting and recognizing of diabetic food specialty as a professional specialty in low and middle income countries. We in Diabetes in D-Foot International firmly believe in equipping the healthcare workers, particularly who are at the primary healthcare centers, because where the more population is there at the grassroots level, with the knowledge and tool to tackle the diabetes-related food complications, closing the gap of available and affordable diabetic food care, encourage the program which are cost-effective and affordable to the universal health care. So, as I always say and would say again, education is the only powerful tool we have, especially in low middle income, which is free of charge for patients and effective if implemented properly. We have a moral and ethical responsibility giving back to the community and help those who are vulnerable. Several projects have been planned and equipped as a healthcare professional with knowledge and skills of excellent patient-centered. All this has already been started in these 2 years, 2023 to 2025. Our programs are all these flagship programs, and which is Train the Food Trainer or Train the Food Healthcare Professionals, followed by step in each country. World Awareness Day, which we do it every year from 7 to 14th November, webinars, newsletters, and all these things which I'm going to talk in my little bit in this talk. Flagship program is a trend of we started in 2003 with step-by-step food project, which carried on for about 10 years. And then it was decided to go to the Train Food Truckers in 2012, which carried on till for next 10 years. And then we said that now we have all the awareness is there, so we decided that Train the Food Healthcare Professional from 2023. So when we train the food healthcare profession, they go and they do it step by step in their country. Most of the food problems, as I mentioned, 85 of them can be prevented through simple early identification and prompt treatment by skilled health professionals. And one of these was step-by-step food project, which started in Tanzania. The program showed that ulceration, infection, and limb amputations are potentially preventable. Any project you start, you have to hit hard and target. Step by step, which was started in Tanzania, and education is important. We have to also know who is educating who, otherwise the message will go upside down. It was a historical moment when this World Diabetes Foundation people, 9 of them staff, came in Tanzania, and it changed the way to look at the low and middle income countries. Same time, the program was proposed by them, and we did step-by-step project. The first one, which was done in 2003, and we had a basic and advanced courses, and about 9 programs were done in Tanzania. After looking at the success of step-by-step, then it was decided to go outside Tanzania. We also did the surgeon project, which was theory and practical sessions, which was in collaboration with Dr. Arun Bal, surgeon. They used to do theory, and then the life cases were shown from how to salvage the foot from the theater. And these were some outcome from the surgeons. You can see where the foot was completely necrotizing fasciitis, and it was saved. The effectiveness, we have to look whether step-by-step is working or not to reducing the rates of amputations. So we looked from 2001 to 2008 at the mean referral hospital, and you can see before that there was a high rates of amputation when step-by-step started in 2003 somewhere, and then it was a slightly peak during that time in 2004, and then it started going -2 standard deviation. This was then successful. Then it went to about 15 African countries and other outside Africa. You can see other outside Africa. But then we said that we cannot go to each and every country, 192 countries in the world. So the concept of Train the Foot Trainer came in 2012, where we said that we go according to the region. So 7 regions. In that region, all the countries, 2 doctors and nurses can come. We educate them, we train them, and then when they go back to their country, they do it step by step. In 2023, we started Train the Foot Healthcare Professional, and because now we know that these are all the healthcare professionals are already aware of diabetic foot problem. So the concept was training the program that teaches courses structure, organized delivery methods, and evaluation skill. And the course runs for expert to train others to become expert in clinical and education skills and knowledge. So there were 3 parts: basic, advanced, and then we also tell them implementation and data collection. And this is still going on. So the first Train the Foot Train courses in 2012 was done in 14 countries in South America, where all of them met in Brazil, and then they went out to their country to do step by step. The second one was done in Caribbean island. 22 countries came together. The third was done under the leadership of Wilma in Europe, Slovenia, where 17 Eastern European countries came in. And fourth one, 13 Western Pacific countries, was done in Thailand. 13. Then the fifth one was done in Marrakesh, where 13 French-speaking countries came under one roof to do this course. And the last, before COVID, we did it in MENA region, where 14 countries came in under this. And then the last year, we did it one in Southeast Asia, which was the 7th Train the Foot Healthcare Professional course in 2003. Then it went back to South and Central America region. 8 countries were trained, and then they went back and did it step-by-step foot project. Western Pacific, where 14 countries came under one roof in Malaysia, and they were trained, and then they were disseminated knowledge by step. We repeated again in Eastern European region, 10 European countries this year in February 2024, and then they went back, did the step-by-step, and we had a report very soon was done in one of the countries, step-by-step food project. And 11th one was done in Africa region, and this was my dream come true, where 11 African countries from 16 centers came in under one roof in Zanzibar, English-speaking countries, and they went and they are still doing step-by-step projects in their countries. The 12th one was done in a MENA region, which was mostly focused on war-affected countries in MENA region. 5 countries took part there, and then they are in the process of doing step-by-step food projects. So in my term, 5 were pledged, which have already been done. There are 2 more pledged Western European region is asking for 13th train the food trainer course or train the healthcare professional course, and sub-Saharan Africa, French countries. We hope that it can happen in April next year. So step-by-step food projects was actually for low-income countries model. Started in Tanzania, it went to the low-income countries, middle-income countries, and then it also went to Europe, high-income countries. So far, it has touched 128 countries where it has been implemented. So it's been a great success, and this is how awareness has been created for past since 2003 till 2024. It's more than 20 years. Other flagship programs is Awareness Week, which we do every year from 7th to 14th November. And this year we have already done this. We are already started. And today is the 12th November, which is European region. Webinars every 3 months we have a webinar. These are the leaders in diabetic food, and they present the consensus what were done in their field. So we have already done about 5 of them. The 6th one will be done by Professor Dr. Dan Wickchen, which will be talking on the surgical aspect. Then we have Jen App, and then the last one would be done by Professor Siko. Partner organization. We have an all partner organization. This is one of the proposals which we have been working, myself and Professor Beata and the board, International Diabetes Federation, European Commission, World Health Organization. This is what we are suggesting, that 4 organizations go together and do a program, an approach to 192 or 93 countries to get a commitment to save the amputations. So it's a proclamation on a diabetes-related food complication to scaling up the global diabetes response. Collaboration between global, regional institution and national government to tackle the burden of diabetes and its complications, and we can reduce amputations and mortality. Signing the common resolution from all the state members, this is our aim, and it should be done under the guidance of IDF, DFood International, and European Commission, declaring willingness to take the comprehensive measure to reduce incidence of amputations, mortality, and in each country. So our key commitment is healthcare authorities deliver the coordinated multi-level care tailored to the local resources in that country. Collaboration with DFood International and IDF. We have a regional chairs advisor in collaboration with International Diabetes Federation Office. We provide evidence-based, validated, and recommendations and tools. Training, the program for healthcare professionals, which I've already mentioned under the guidance of International Working Group of Diabetic Food to implement, is DFood International is the implementation arm of International Working Group of Diabetic Food. Implementation of the primary healthcare programs and need to emphasis on diabetes-related food complications, screening, treatment, and recurrence of prevention of these amputations and ending the mortality. So all these things has been visual, and we managed to do a signing with the initial stage with International Diabetes Federation, where we had a meeting in early October in Ivory Coast, where Professor Peter and myself, this is the first step which we took, Abidjan Pro-Action Declaration on Diabetes-Related Food Complications. And the next one, we want European Commission to be a part of it, and then we go, all 3 of us, to WHO, and then we proceed to go further, where we can get a signatory from 192 countries. IDF has been working with us for a long time, and we have done several projects with them. All these things was done under the auspices with IDF, or sometimes International Working Group as well. So 3 of them. We have a very good connect together for a very long time. We work together, and Professor Fengem is now chairing the International Working Group of Diabetic Food. We have also produced all the info cards for people at the middle and low income countries, even high income countries, for the doctors and the nurses. They also International Symposium of Diabetic Food members, they came this year in February, and they did teaching at one of the Kilimanjaro Christian Medical University, KSMC, and they educated 54 delegates, which were targeting physicians, surgeons, orthopedic surgeons, and nurses. We have also good connection with International Association of Diabetic Foot Surgeons. We had several meetings together and conferences. Recently, we had this 21st Diabetic Foot Society of India, 10th International Association of Diabetic Foot Surgeons, and 2nd D-Foot International Conference in Mumbai, which was very successful, and where we all got together and declared that we're going to work together for the sake of benefits of diabetes-related foot problems. Then we have a Limb Preservation Alliance, which is an alliance of four Wounds Canada, American Limb Preservative Society, and Canadian Podiatric Medical Association, along with D-Foot International. And there's a couple of programs which we are doing at the moment with them. We have a newsletters coming every 3 months, and that's a 6th newsletter which came last month in October. Several projects we have done. I've already mentioned about the global course study, which is almost in the press to be published. Then we have an Afro-Dial project, which 12 African countries got together, and we have a footwear project for low and middle income countries, which we looking for the footwears. Then we have auditing and benchmarking, with one of the delegate from a board member, Roberto, is taking care of this, and we hope we can finish this thing. We have rehabilitation and mobility technology for low middle income countries, looking at them, mostly assisting their people with diabetes in low and middle income countries. Fast track pathway has been started launching in many countries, and this was also launched in Pakistan, Karachi, where 150 health centers have got together to launch this thing. In China, we did step-by-step food project. In India and in KSMC was also done this year and last year. We have brochures in many languages. If you don't understand English, or you can go to the Chinese language or Portuguese or Spanish, all of them you can download from the World in D-Foot International website. Then this was the conferences which we do annually. The first one was done last year in Malaysia. The second one was done in Mumbai this year in September, and the third one would be done next year in Malaysia again between 9th to 11th May, and where my colleague, President-elect Professor Harry, is going to take over from me. So where do we go from here? In summary, many reasons for poor foot care in various laws have been discussed. Increased high technology, rocket or genetic science will not change the practice, especially of diabetic foot in low and middle income countries. So if I have been asked, what will change the practice in next 25 years? Reply to this question is not high technology, but rather dissemination of knowledge. And it has been shown that prevention and knowledge can save 85% of amputation. So two distinct areas has got an impact. Powerful tool for prevention and control of foot complication in less developed countries, and empowering the healthcare workers. These are thanks to my staff, because without them I could have not reached where we are, and all the colleagues who are helping me around the globe. In conclusion, I deeply encourage each and every member of D-Foot International to actively engage in activities. Your unique perspective, insight, and dedication is very important for D-Foot International. Together, we can improve the life of people with diabetes. Together, we have a power to make a difference, and let us collaborate, inspire, and transform the field of diabetes-related foot complication for the betterment of the patient. Last slide would be, I would to give you a message from a Holy Quran that knowingly or unknowingly, how many lives we are saving as a patient, as a doctor, saving the lives of the patients. So if you look at this Holy Quran, chapter 5, verse number 32, it said that save one life, you have saved the whole humanity. That means you get a credit of whole humanity, and at the moment, humanity stands at 8 billion population. But if you kill one person intentionally, it will be killing or getting a curse for whole humanity. That means you get curse for whole humanity, which I already said, which stands at 8 billion population. Thank you very much for listening, and thank you very much for all the work you are doing. Thank you. Thank you very much.